Hello everybody, my name is Farah Al Haj and my poster today will talk about a rare serious condition which mainly occurs in patients with end-stage renal disease. This disorder is calciphylaxis or calcific uremic arteriopathy is a better description of this disorder. Calciphylaxis has an estimated 6-month survival of 50%. Although I said it mainly occurs in patients with end-stage renal disease, it still might happen in people with normal kidney function and in those who received kidney transplant. The pathogenesis of this disorder is still poorly understood and unfortunately there is no approved treatment yet. Our patient, she was a 38 years old female patient with a non-medical history of end-stage renal disease on hemodialysis, hypertension and postpartum cardiomyopathy with ejection fraction of 21%. She presented with altered mental status and worsening of her chronic medical conditions after she missed her hemodialysis for a month. She was a little bit tachycardic and desatting on room air, but otherwise she was hemodynamically stable. Her labs came back significant for a blood glucose of 36, which was treated. On physical exam, a thick, hyperpigmented abdominal wall with foul-smelling, large, non-healing left-sided abdominal ulcer was found. Initially, she was stable enough to be admitted to general medical floor, but a day later she became hypotensive and developed acute respiratory failure where she was intubated, pressors were started, and patient was transferred to the ICU. She was treated empirically with antibiotics, CFP, metronidazole, and vancomycin, which did not help in her case. At that point, we went further back in her chart and we found that this patient was admitted 3 times prior to this admission with a chief complaint of generalized abdominal pain and tenderness. No diagnosis was made on her previous admissions. The suspicion was raised that this patient might have calciphylaxis, so we ordered a few labs to support our diagnosis. Parathyroid hormone level came back high, but not as high as it expected to be in patients with calciphylaxis. Calcium was in the lower side, phosphorus was high, but not crazy high. So surgery were consulted, wounded treatment was done, and skin biopsy was sent. Pathology report came back consistent with our suspicion of calciphylaxis. Sodium thiosulfate was given to our patient and she was already on Selvamir. Her wound did not heal and eventually she was discharged to a long-term acute care facility. So calciphylaxis usually start as a painful skin lesion which rapidly progress to ulcer with a black ulcer as we can see in figure 4. Prevalence of this disease is between 1 to 4% with annual incidence of 35 out of 10,000 patients undergoing dialysis in the States. Our mean age at time of diagnosis is 50 to 70 years old, while our patient was 38 years old. There are a bunch of risk factors such as obesity, female sex, warfarin use. The patients treated with peritoneal dialysis have higher incidence than patients on hemodialysis. Our patient was on hemodialysis. Sepsis is the most common cause of death in patients with calciphylaxis. Calciphylaxis might be classified in different ways, ulcerated, non-ulcerated, central, peripheral, uremic, and non-uremic. Our patient, she had ulcerated central uremic lesion. As I said, pathogenesis is still poorly understood, but there is proposed pathogenesis which says it's an imbalance between factors that inhibit and factors that induce calcification in our body. In our body, we have a matrix galaprotein which directly inhibits calcification, and it also inhibits the pro-calcifying factors such as bone morphogenic protein 2 and 4. MGP found to be low in patients with calciphylaxis. MGP need to be carboxylated in order to work, and this carboxylation need vitamin K. No proven treatment, pain management and wound care is still the mainstay treatment. Sodium thiosulfate found to have vasodilatory and antioxidant effect. We need to keep calcium, phosphate, and parathyroid hormone level within normal ranges. To summarize what I said, calciphylaxis is a complex, life-threatening disorder that involves cutaneous microvasculature leading to skin ischemia and necrosis. The main goal of wound care is to prevent infection, as sepsis is the most common cause of death in these patients. And thank you.